So on the 15th of May, no, before that, on the 10th of May, a Congolese national came into Uganda and he was sick and he was admitted at Chibuli Hospital. Little did the health workers know that this was a case of Ebola disease. And he died on the 14th, 4 days later. When he died, the health workers were suspicious. They took samples from him, and on the 15th of May, they confirmed this was a case of Ebola. And that's why the Ministry of Health announced that there is an outbreak of Ebola after confirming the death of that Congolese. His body was returned and buried in DRC. So since then, this is what has happened. As of today, we have registered 20 confirmed cases. Those are cases that have tested positive for Ebola disease. And all of them, it is this very strain of Ebola individual. Over the 20, 15 are Congolese nationals who came into Uganda seeking medical care. So you can say the outbreak we've been managing is an imported outbreak because the epicenter where it originated is in Congo. And now it came to Uganda because the Congolese were coming for medical care in Uganda. So over the 2015 were Congolese nationals who crossed over to Uganda. Now, especially the first case, because the health workers didn't know it was Ebola, 4 of our health workers got infected. And then, so those are 15 plus 4, those are 19. Then 1 was a driver who transported one of the Congolese when he was coming. That is the 20. Now, of the 20, 2 unfortunately died. They were Congolese nationals. And when they died, their bodies were taken back to Congo for safe and dignified burial. That leaves a balance of 18. Now, the 18, they have been managed in our Ebola treatment unit in Morago, and I am happy to say that this morning, I presided over a function where we discharged the last patient. So all those who tested positive for Ebola, 2 died, then the rest have been treated successfully, and they have been discharged. The last one, who was a Congolese national, was discharged this morning. So as of now, we have 0 cases in the country. Right, Honorable Speaker, let me just explain one point, then I sit. Discharging the last patient does not mean that the country is Ebola disease free. The World Health Organization standards and recommendations is that when you discharge the last patient, then you start on a countdown. The incubation period of Ebola is 21 days, is up to 21 days. So we count 2 cycles of the incubation period. So we shall count starting today, 21 days plus 21 days, those are 42 days. So if in the 42 days we don't register any positive case, then Uganda will be declared Ebola-free. What we have done, Right Honorable Speaker, is that our president talked to the president of DRC, and the 2 heads of state agreed that we handle this outbreak jointly at the 2 governments. And the 2 ministers of state signed an MOU. I signed on behalf of the government of Uganda, and my counterpart, Minister of Public Health in Congo, signed and agreed on a number of interventions to jointly pursue. One of them, which we agreed on, it's very important, I inform Parliament, is that this is an imported outbreak. It came into Uganda because Congolese were coming to Uganda for better medical care. So we agreed that the government of Uganda will support the Congolese government by establishing Ebola treatment centers on the other side of Congo. And the President authorized us to open up to 4 centers. We have so far opened one in Aru. Aru is the area which oversees West Nile. We have also opened one in Kasenyi, across in Toroko, Lake Albert, but we have also deployed experts in Bunya and Gwampara, which is in the center of Ituri. So we have sent over 50 specialist health workers in Uganda to support our counterparts in Congo, and also agreed on joint surveillance, joint monitoring, sharing information. We have established a laboratory in Arua and Bwera and Kasese. Some of the samples from Congo are brought to our laboratories, but also we have Uganda Virus Research Institute and another one in Wandegeya. So we have joint collaborative activities. So although we now register 0 cases in Uganda, but the collaborative interventions continue, and we shall work with Congo until they register the last case.
Thank you, Right Honorable Speaker.
So like I have said, the case fatality rate means of those whom you tested positive, how many have died. We lost only 2, which translates to 10%. And for this strain of the virus, the case fatality rate usually ranges from 25 to 36%. That means we have done very well. We have not lost many of our patients. The other strains like Ebola Zaire is extremely virulent. It can kill up to 90% of those who test positive. But this one is a little less mild, but it can kill up to 25 to 36%. But this is an average. If it finds when you don't have a strong system in the country, it can also kill up to 90% or even beyond. So the fact that we've been able to have a low case fatality rate means our response system has been fairly effective. And even those who died, yes, you can clap for that. Even those who died, they died because they presented late. They presented late. And in the last 21 days, we have not registered any positive case. And in the management of Ebola, when a patient tests positive, then you trace back and get to the contacts. Anybody who has been in contact with that patient in the last 21 days, you round him up, or you bring him to isolation. And we did this. And through that system, we were able to identify 836 contacts who were in touch with these 20 cases that tested positive. We put them under isolation. They completed the 21 days. None of them developed symptoms. None of them tested positive, and they have all been discharged. And that is a very important element in managing Ebola disease. Now, compare these results with what is happening across among our sisters and brothers in the DRC. I spoke to the officials. As of today, the 16th of July, they have 2,011 Congolese who have tested positive for Ebola. And they have lost 754 individuals due to Ebola. So in Congo, I was there a few days ago in Bunya, leading a team of Ministry of Health and WHO. I am very safe. I am very safe.
Upon your election as Speaker of the 12th Parliament. Honorable members, I'm Julius Mande, Member of Parliament of Konzo County East, and by the grace of God, Chair Health Committee. But importantly, I rise as someone with experience, having treated the first cases of Ebola Bundibujo, while I practiced as a health worker in 2007 in Ichicho in Bundibujo. And additionally, with experience working with the World Health Organization for the past 14 years. Now, I have to say, colleagues, we need to appreciate the Honorable Minister of Health for a comprehensive statement about the current trend of
that the Minister of Health has been able to come here to brief us. Much as members are fearing the issue of somebody who has gone to a country where there is this problem coming to Parliament, it is necessary for us to be briefed so that we can also brief others to remain safe. As chairman of the West Nile Parliamentary Caucus, therefore, I would like to thank three categories of people. Number one, the government of Uganda. For the reason that the government of Uganda took action first within Uganda and also took the initiative to put a treatment center in DRC, particularly in Aru, the sister city.
Comes a time when this August House must stand united in expressing profound gratitude to government. I believe this is the day. Honorable Speaker, I want to thank the government of Uganda through Minister of Health for their very decisive, swift, and very effective solution, which has helped us contain this outbreak from its source in Congo. I also want to commend our heroic doctors, nurses, and all medical practitioners on the front line now in Congo. Really, they remain exemplary. Honorable Speaker, Toroko district is a border district. We share extensive trade links with the Democratic Republic of Congo. Honorable Speaker, we have had to bear the burden of these preventive